Good evening. My name's Adriana De Julio. I am a medical doctor trained in neuropsychiatry. I am currently licensed in the state of Colorado, Illinois, and Massachusetts, and I'm taking this opportunity to do another video on public health and how it relates to mental health care. At this time, of course, the focus is going to be on the COVID-19 pandemic, and it felt very important to open the doors to some of my collaborators and some of my connections in regards to how healthcare workers can take care of themselves at this time. Specifically, my work with the Center for the Study of Traumatic Stress, which is part of the Uniformed Services University in Bethesda, Maryland, has helped me form a couple of documents that I'll be linking you to and posting that focus particularly on how healthcare providers can maintain their health, physical health as well as their mental health. The first document that I'll be sharing is specifically geared towards helping hospital workers maintain good sleep health, especially during this time. I know I, for one, have pretty much worked every day for the past 3 weeks on multiple projects with the City of Denver Public Health Department, Holy Family Hospital. So there's been lots of different agencies that I've been working with. And during this time when you're specifically stressed and needing to see more patients and do some things you may not have had to do in a while due to short staffing and shortness of hospital availability in beds, you may find that your sleep is definitely taking a hit. This is a guide to talk about how sleep is a tool that can help you help your body and fight off infection, maintain your health, and perform at the best. And performing at the best obviously has a positive effect on our mental health and on our patients' outcomes and even how their mental health may go, especially if we're working with patients in the hospital or in assisted living facilities, nursing homes, rehabs. They are very much quarantined with no visitors, and it can be a stressful impact if their physicians and providers are also fatigued and tired and not taking care of themselves. The second document I will be linking, and there will be a PDF available at the bottom of this video, is focused specifically on healthcare providers, mostly physicians and mid-level providers. It could also be applicable to nurses. And it helps to start identifying your strengths, things that you might need to get through this period of time as the pandemic is going to continue for the next foreseeable future, of impacting how we practice and our families and our homes and our universities. So it helps also identify core principles for managing your stress before it manages you. It helps to identify some 8 basic coping strategies, and then how to take those specific strategies and personalize them to yourself and your environment, your home. Every person's environment is unique, and so it's nice to have ways to kind of make these things your own, your coping skills. And then the last part is how do you provide help to others after you've identified your own strengths and maybe needs. At the bottom of this as well are some links, if you're in the state of Colorado, for the National Alliance for the Mentally Ill. They have set up a specific peer-to-peer support group and peer one-to-one support availability for healthcare providers who may be dealing with an increase in mood symptoms. They may notice that they have depression or anxiety that's starting to become mismanaged. There are Zoom groups as well as phone call one-to-one peer supports, and that's available to any healthcare provider in the state of Colorado at no cost. I think that at this time, we're all going to have challenges to maintain our physical health, our mental health, and this is just some nice ways to, as we start into the pandemic, this is just the beginning, how to utilize our strengths and resources appropriately. Many people have asked me what they should do with mentally ill people in their practice because they're afraid to send them to the emergency room, or they have questions and concerns about them not being able to access their therapist or their psychiatrist or neurologist due to so many restrictions on travel and even many clinics closing. In the state of Colorado, fortunately, we've had an open policy for clinics where most clinics have not shut down that are emergency mental health clinics. All Health runs multiple 24/7 crisis centers. So rather than sending your patient to an emergency room, you can send them to a crisis center for evaluation and resources immediately, avoiding the whole process of sitting in an emergency room trying to see a social worker for resources. I think that these crisis centers are run also at the public health department and other nonprofits throughout the state of Colorado. I mentioned All Health because they have many, many locations here in Denver and Colorado Springs, Castle Rock, Pueblo. So I will be available by email if there's a question and you need to have a FaceTime conference with me about resources for yourself or for other people. That can be arranged. Please do email me at adehulio@summitmc.org. I will be getting back to everybody with more videos later this week, specifically on navigating children and being at home during the pandemic, or as providers having to work still and have our children at home, and ways to kind of cope with talking to them about what's going on, such that they have some understanding, as well as ways to find your perfect sort of mean when you have to work and then come home and your children haven't had really the rest that the stimulus or stimulation that they may have needed during this time period, especially being out of school. Many children, I think, will start struggling in the next few weeks with boredom and not really being so happy to be out of school, and how parents and people who have children in their lives, parents or just aunts, uncles, grandparents, may want to help those kids. So that'll be coming in the middle of the week. Later this week, I also have a video on navigating resources for patients and signs and symptoms to be aware of that may show that the patient is having an acute stress reaction. This may be another provider or an actual patient that you're seeing in hospital and assisted living, nursing homes, rehabs. Those patients are specifically high risk of developing post-traumatic stress from this or acute stress because they've been not only isolated, but they are not allowed any visitors from the outside. And so they are they're a very high risk population because of the isolation that most of them are experiencing. So that'll be the last video that we'll be doing this week. Again, questions or comments, please post below, and I look forward to your emails. And please stay well, get great sleep, exercise, wash your hands, and try to connect socially as much as you can using technology and our phones and the systems that we have set up that make connecting with people so much more easier.